question. I think because I've been doing a lot of, running towards my son on pavement. Aussie way.
Where are you?
Nope. It's like, I think it's the bursa, like I think it's internal.
Do you think it's... Okay, so when I'm, so she's notified that her knee is not great, so I'll probably always keep a little bend when I'm stretching to like prevent any hyperextension or whatever of the knee. Okay? All right,
That's why I mentioned.
okay. And you can go anywhere you want, man. Videographer lady. Okay. So I just, connecting it first. I'm just kind of...
I'm the creator of Yoga Retreat. Thank you for joining me on this peaceful journey through music on Pandora.
Did you feel
If
that?
my tunes bring you
Did you
Yeah,
notice
we
that?
locked in.
We just, yeah. Shit. Hopefully YouTube allows that. Okay. Alright, so what I do, you see it says palm walking. I take my hands and along like where her tibia bone is. I just, and she's littler, so I kind of do this, or you can, push down. But I'm using my fingers, not pushing down on her bone. And make sure your body, when you're doing Thai, you're not like this or like this. Kind of stay upright and kind of use your body as a tool. You know what I mean? So a lot of rocking is good. It doesn't have to be perfect. You don't have to do it in that exact order. And again, when you get near like the whole pelvic crotch region, I'm not going to be like this. I'm going to just have hands out. And even getting on the table is fine. And I sweep down. You can get up and you can do this number. Sorry, your muscles are tight
It's
now.
okay? Yeah.
And so when I'm doing the deeper stretches, I will communicate pressure because it can be really intense and tight. You okay? You laughing?
Yeah.
Because that's so intense.
It's good.
All right.
It's like,
So, and the other way you can assess the alignment of the body and the gait and everything is by beginning stretching, palm walking, looking at the feet, and just do a little bit of stretching. And I'm stretching myself too, the things I talked about on the first of the board. You okay there? Do you feel safe? Knees okay? I do check in a lot and ask a lot in the beginning, like, are you okay? Do you feel safe? Because if I haven't worked with her before, then I want to make sure I'm not overextending. Because sometimes you're like, no, I'm fine, and they're like in pain or not feeling well. Do we turn the music down or you're okay?
turn down a
A
little
little bit?
Thank you.
All right. So what this is indicating to me, let's say that she was tight and I couldn't really push over. You're going to see everybody different in here. That means her mobility is actually pretty good in the legs and the hips. I know you're going to say no, they're not, but I'm just telling you sometimes when it's super tight, it means there's some restriction up here somewhere. So pretty good. Okay. And I'll sometimes stretch and traction, but I always bring the legs up about 30% of a degree, because especially with women or people that have had babies, sciatic issues, if I just pull and yank, it can disrupt issues with the sacrum attachments. But if I lift up a little bit, it gives a little bit less of that pull and just come. I can come back. You okay there? And when I'm pulling her, I don't just yank her. I want to pull from all the way out and down. Does that make sense? So that was the palm walking thing I did that you saw there. I did. You can do that a couple times up and down. You can do it once, and then you can see the feet turning like I did, just kind of stretching. And stretching. Oh, and then I want to add this one. This is the Anna one. So this is the, that's one, but I'm going to put plus overturned, or however you want to call it. Make whatever names you want that helps your brain remember them. So what Anna taught is that you can actually stand at the head of the table and take leg, and I'm going to take this and pull it this way. Pull and over. And I'm getting a nice stretch in my lat area, my back. You feeling okay? You feel safe?
Yes.
And then this way. Feeling safe still?
Yeah.
Do you feel like I'm pulling from the head out or here? I know you're feeling it here, but do you feel like it's trying to come down here?
It doesn't, there's not like an intenseness at all.
Okay. Good job. I don't want to be chewing gum like I am, so I'm just telling that too.
This is what Anna does.
Yeah, she does some Thai work too. She does some different things, but this is one of the positions she taught us. It feels just good to stretch yourself. Are you feeling okay and safe? Good. All right, and then for cross, I just make the legs looking like a 4, kind of like that. And then I sometimes leave it on the table. You don't have to. You can just do here. Doing okay?
Yeah, it's great.
And you'll intuitively be able to tell. I get heated when I do this work, but it's good though too. You'll be able to tell when you're working on somebody if they're resisting you, if they want to work with you, and you can just check in with them. So sometimes facilitating encouraging breath, so she's kind of like this, might be like, okay, go ahead and take a nice deep breath in when you're ready. And then exhale, and I'm gonna work with her breath. Does it make sense? And you can kind of alternate if you want. And then I get onto the table, and I'll alternate. I'll do this number. Sorry, that's okay. It's right there.
It doesn't matter.
Sorry.
That's the stuff.
Right there. Did I hurt you? Yes, a little bit. Okay. So you need bills.
A wham.
Just like, you're not seeing my little nipples, are you? Did you?
I don't know. I
can't
don't think
ask.
so.
You too. What's up? There. To be
I'll
honest,
make it
right?
private.
Brooks, to be honest. And then sometimes I'll do this. I try to keep myself arms long. I try not to do this stuff, you know? And then everything I've done on one side, I'll go to the other. You can do everything on one side. I like to alternate though, just to kind of balance the body out. So come to the other side, same thing as the 4 cross palm work. I know it's opposite side, but you can do table, you can do just one side. I sometimes find starting here,
This one feels tighter.
yeah, a little bit more, and it's more coming from here.
Yeah,
Yep.
totally.
So you'll be able to assess the body by when you're pushing and doing, you can see where the stagnation or stuck space is coming from. Because when she said that, I was like, it's sacrum probably, right?
It's my sacrum. Yes.
Yeah. To be quite honest with you, if I could choose any style of massage, this is just me talking, doesn't mean you have to like it. I love yin yoga and I love Thai work. It's just easier with clothes on. It's not that I don't think it's good to massage a regular body. It's just oil and it's just a lot of stuff, and I love it. I do both. But I just, something about this work, and it's very effective. It's too many good things to say about it. You know, the whole list in the top board is why you can benefit from it too, because you're stretching yourself. And so, as I'm on our quads here, and I can feel kind of like, and I fall over on one because they're just a little hypertonic. She jumps on the trampoline and walks and runs. So I'm just trying to be mindful of that. So don't just push down and hurt her because it's a little aggressive. Yeah, the work. Doing okay? All right, and then I might come back in between and kind of go back to I might do a little palm walking in between each thing if you want to, and just sweep down. You can do that. You can traction if you want to. A method for lymph release at the end sometimes that I do is you can take the body and you can shake.
Oh yeah.
That's really, really good for the lymph. Your stomach's starting, it's like going down my throat. You can see it.
You can see it just like
Well, no, I felt it down my throat.
Yeah.
Because most of the lymph is like 50 to 60% of the lymph is in the belly. Okay, so there's that. So we did the palm walking, we did the feet turning like we talked about, and we'll do it over and over. And the overturn on the side, we did the 4 palm cross, and then the hamstring stretch. So I come over here, and you can sit on, it depends. Of course, it can be small, big, tall, old, young, and so she's tight, but I'm just
I've always not had good range of motion.
So what I'm gonna do with her is I'm gonna check in. You're probably at a 4 to 6 right now.
Okay.
Yes? Intensity, like 1 to 10, 10
It's
being
getting pretty intense.
7?
No.
6.
6.
6. So what we want to be at on a 1, are you doing okay? There's no sharp
good.
pain. So it's like yin, you describe it to them. Are you having sharp stabbing feelings? No, then you can stay,
It's
but
an
it's intense.
intense
Yes. And so if it's really intense, you come back a little bit.
Yeah.
Relax your leg a little bit. Let me have the weight. Good, perfect. And you want to be like on a 1 to 10, 10 being way too much, 1 being not feeling anything. At least a 5 to an 8. And someone that's used to it, definitely more towards a 7 or 8. So go ahead and take a nice breath in for a minute. Are you feeling it along here? Yeah, and you can do other things like this to her. Is it okay? Mm-hmm. And you can play around with this. Just because I'm doing the hamstring thing doesn't mean you can't play around with it. One more breath in. And push. So see how I'm getting a nice stretch too? Good job. Then I'll come back. Pull the energy out of it a little bit. And then I'm going to do that bottom one. Just do a couple things here. So the quad stretch. So here we go. Start there. You can actually sit on the foot if you need to. Or you can use the table. And just brace along it. I do this. And I pull. You doing okay there?
Yeah.
Does it feel good?
Yeah, it's intense.
Sorry.
No, it's okay, it's good.
And then I might just come back a little bit, always counterbalance.
I like
And sometimes people will do what she's doing to protect themselves.
Right,
And
this
that's
is-
okay. And that's fine. No, it's okay. Even men and women, everybody does it. You have to. Wouldn't you just be like, hey, come on in, when you're trying to like release like trauma, you know?
Mm-hmm.
So you can just say, hey, if it feels comfortable for you, I'm just gonna do this side, you can just do this if you want. If it doesn't feel right, put your arm back to where you want. And then that gives them the choice to choose what works for you. Not because I'm telling you to do it. Does it make sense? Okay, and then sometimes I'll just kind of do a little crossover for a minute. Just little ones. Alright, but that was the hamstring one. We did this one here. You can do it standing. And I'm not going to go into it yet again. And then I just bring the heel closest to the bottom. We're going to do this multiple times. And then you can do the pulling thing. Sometimes you can go the opposite way if you'd like to. And then some people do like a little cupping thing like this. So there's so many things you can do with one. It's like you get your Christmas tree and you decorate the shit out of it. You go one little area and you put some stuff into it, right? Alright, so you did the hamstring, quad, you doing okay? And the wide leg, take this, and I always communicate, and I can put it on the hip, and I just hold here, and I say doing okay. You feel it on here. Breathe in. Exhale. You tell me what. Right there. Outer or inner? Your adductors, gracilis, inner groin muscles. Okay, relax. Does it feel better higher or lower? Or just right where it is fine.
Right there is good.
Right there. Okay, take another breath in. Good. Good job. And then come right back. That's up my leg. Are you having pain in the hip at all?
No.
Okay. So what I'm gonna do, because I just did a hamstring, quad, and one wide leg, those three right here. I'm gonna do it on the other side. I just kind of sometimes root them a little bit. You can play around with it. You can do everything on one side and then the other. And then here, same thing. Go ahead and if you feel comfortable, you do this, whatever feels right for you. It allows the space to open a little bit more. You're a lot tighter on this side. It's from your sacrum, I think.
Yeah, my secret was angry. Gosh. Yeah.
You tell me when. Do you feel it in the sacrum or in the bum in the back
It's in
area?
here.
1 to 10.
I'd say 6 or 7.
Let's go a little bit more. Does it want to come back a little bit? Okay. Good. Good. Good job. I always, not reward, what's the word I'm looking for?
Encourage.
Yep, I encourage and I do a lot of good job stuff even though we're all adults because when you're going through stuff and you release things, especially in meridians like this, you need to be validated on knowing that we're safe. That's what I feel. It's just like an energy thing. You can do whatever you want. You don't have to say that, but I feel like if you're willing to let something go around me when you're doing it yourself and I'm facilitating it, I'm telling you good job. Right? I'm not meaning like, oh, good job, It's just good job for allowing yourself to do what you're doing. Right?
Thank you
Okay.
for letting me help you.
Yeah. Are you sad right now? You're like, fuck off, Suzanne. Just kidding. All
Get
right.
out of there.
So get out of it. Okay, so you can block off the foot if you want to. You don't have to use boots or whatever. And you can do it this way like I talked about. She's littler, so I find if the foot's isolated to do this, pull, take an inhale. You ready? Good. And exhale. Good. Really tight, you feel that? You
Yeah,
okay?
it's good.
You too
You
much?
can keep going.
Okay, ready, another breath when you're ready. There's no rush here. Good job. You just feel that release when I said that right before?
Right there.
Good. And then, so we did the hamstring, we did the quad, and then we're gonna go just kind of stretching a little. You don't have to do this, you can just kind of,
I hope to get a pocket. God, there it goes.
I'll get it even more. It's like, I'll get here in a minute. Just kidding. I'm gonna get right in there. Are you gonna relax your leg? So if they try to help you, let them not.
Oh yeah, that's me.
It's alright. I mean, we just do it, just whatever. Take a breath in when you're ready. Exhale.
Okay.
Oh, right there. Okay, it's enough. It's coming back. Right, ready? Was it inner or outer?
Inner.
Breathe in. Exhale. When you tell me when, just say when, okay? And then sometimes they can go a little more, but like once they've been in it for a bit, and once they've worked with you a little bit. Does it make sense? And if you're like, yeah, I could probably do like a smidge more, I would hypothetically come out of it to give your body a rest. Like, it's like restarting again and just going a little bit. And once I learn you, I would know that's enough. A little bit, probably. So you'll intuitively read where they're at once you learn them a little bit. Okay? And then
It's
so the-
only on the hold that it starts to get on the exterior.
yes, I think your sacrum's locked up. That's what I think.
It totally is.
I think you need the deep lunge action.
Yeah.
So there's different ways to do the lunge. You can do it like this. I find that fine. And then I'm gonna have them do this. If you're comfortable with it, you do what you want. If you want to put your arm back, it's fine. But I like, and I know it looks ridiculous, I like to sometimes do this, or you can use the arm.
It's like assisted happy baby.
Yeah, it's a little weird, but
Half happy baby.
you okay there?
That's excellent. Yeah.
Stay or go or
You can go deeper.
Okay, breathing in. And exhale.
That's great. That's excellent.
Good.
Thank you.
Yeah, and you can repeat these. So even though I'm doing it once, if she's like, oh, I really like the hamstring one or the deep lunge, you can go back to them. You have to. And so with that, I'm going to come to this side and do the deep, we just did the wide-legged, we just lunge, and I'm going to do a little twist. And so I'm going to have you come all the way to this side and move yourself up just a little bit. Yeah, perfect. And so this one I always recommend, have the people get to the closest side of the table you're going to turn, especially men, because they'll feel like you're going to drop them on the ground if they're not the closest. And we'll go over this a million times, please, okay? I promise. And don't let them help you. Let them stay flat. I hook my hand into their hip. I take this, and I have her do that. You okay there?
Mm-hmm.
Okay, go ahead and pull your arm up and reach. Alright, so she's so flexible, I'm gonna now, and she's smaller, she's not like a big, huge fucking macho man, like, that lifts weights, because they can be big and it's hard to, come over here closer, because I'm gonna drop her hip off the table a little bit, so you can assess and move things, good, yeah? Maybe a little bit more, just because I want you to fall off the table. Okay, good. So we're gonna do this again, go ahead and expand your arms up if you want to. Good, up and over, and you tell me when, you tell me,
That
you
hip
okay?
doesn't want to.
Is it
okay.
painful
Just go slower.
and sharp? Are you
It's
okay?
all good.
Okay, relax.
That's so
You
neat.
know where it's coming from? It's in here.
Yeah, that's been screwed up.
Yeah, it's
That's
in
been
here.
super
That's where it's
screwed up.
starting. That's grief stuff. Yeah, that's grief. So this is blocking this. Okay, let's do that. You're doing good. This is a very intuitive practice. I like this. I've always liked it. I read people a lot quicker, I think, in what they need or what I'm feeling from them, because there's a lot of emotional meridians. You're not just like, going like this, which is good. I love all that. It's amazing. You make great money doing it. Please do it. That's why you're here. But this is also a form of massage. And it's just different. There's all sorts of forms of it. But when you're working with yin yoga therapy or like the Thai massage stuff, and you're holding and pressing an area where there's stuff stuck in the connective tissue and fascia, you're gonna feel stuff from them immediately, especially if you're hyperphysical empathy like me, I'll know what it is. Just my mind goes there. Not because I'm feeling it or seeing your legs resisting. Sometimes that's it. I'm like, oh, grief, lungs, intercostals. It's like, and let it go. Do you know what I mean? Okay. Alright, so let's do the other side. And again, the lunge ones you can do like this. You could do like this. That's another way. You don't have to get on the table. There's a lot of ways to play around with it. Yeah. Does that feel okay on that side?
Yeah, it's totally fine right
And
now.
then watch your leg. Yeah, take a nice breath in. And exhale.
So is this the deep lunge?
Yes. Yep. Good job. Okay, there. And in between, I might, do a little of this again, a little the lymph shake. Excuse me. I just went down my throat. Sometimes I do this. Is it funny? I do this. It feels great. The thumbs right into the.
Man, that's
Okay?
intense.
I'm
Yeah.
sorry.
No, it's okay.
I think you just got your kidneys go water in.
Oh
So
my god.
and you can do things with the toes.
Thank you.
Yes. Sorry, that's free. I don't really do that as a therapist. Sorry. just did that, so now we're gonna do this side. Here we are.
Is that your room?
Did I fart? No, that's my room. You're more like open here on this side. You like that?
It allowed you.
Usually intuition comes off the left side, like communication pieces, so I feel like that side. I mean, I know it's like structural stuff. You doing okay? Am I hurting you?
No.
And you can do things like this, while they're in that, if you want. There's all kinds of stuff you can do. There's no limit to this, you know what I mean? You can help a little bit, like this.
That's great. Oh, that's awesome.
You okay?
Yeah, it's great.
Good job.
Holy shit.
You okay? Do you want me
That's
to even it
awesome.
on the other side?
Sure.
Yeah. Here we go. Because sometimes they'll start to come up, turn on their side, like, oh, go ahead and lay right on your back, because then you can get good leverage to lock it in and turn. Because if they're already turning, you don't have the ability to lock down and turn it. Does it make sense? Because if I just go like this, it's good, you know. But sorry, okay?
Yeah.
But if I do this, doesn't it feel like there's more?
Is that a wide leg?
Sorry, where are you feeling it?
It's good.
Your back.
My hip is kind of weird.
Right here?
Like
Show me where.
interior.
Show me where inside.
Yeah, like in the
Not
center.
your psoas. Yeah.
Yeah, probably. Always had sciatica shit.
Do something over there on that side. Hold on a second. Flash what?
Oh, that's great.
Right there? Yeah. And after you've gone through them, you can just kind of fly through a little bit. I feel like you need this here.
That's fantastic.
This one here. Take a breath in. And exhale.
So that's quad stretch you did.
Yes,
there, right?
yes, exactly.
Quad stretch. And before was
The
wide
Yeah,
leg.
the hamstring one. And I'll show you guys too. I'll just do it like super fast. Yeah.
What's that one you're doing now?
I was just kind of like rolling it around a little bit. This one I went back to the quad one because I just felt like she needed it a little bit
Can
again.
you show wide leg? Okay,
Yep,
that
this
can-
one is the wide leg one here. There's the knee. And you okay? Is your sacrum hurting you?
I think I'm probably babying it because I
That's
know
okay, 'cause
because I
you're
know that
sciatica.
it's gonna because what'll happen if I don't keep it then
Okay,
it
so
might.
I'm gonna have you do something. If somebody tells me that, go ahead and sit up. Table, sit on that square, I'll sit on this one. And face me. Okay, so this is what you're gonna do. I'll let you go with that.
I need to go on the other side. Hold on.
Stack. It's not too bad, is it? A little bit like popcornish, attic-y kind of pantry smell.
I can't.
Okay. Can you
On me? Oh, he gets me up.
This is gonna be like the worst video ever because I'm short and I'm like moving up and down and
and you hear like all kinds of shit.
now we're talking about popcorn feet.
Ah, it's me. It's okay. It's not bad. It's not good. It's not like a still office in July with us AC.
On YouTube, this is what would actually go viral. This is how she'll make $1 million.
Well, we've talked about that.
Just
I
get
want
some coverage
content.
here.
That's what I was at. It's our first video.
Where do you feel this, ma'am?
It's in here
More so on that side than that side?
right now.
Yeah.
In here.
And 1 to 10.
Oh, it's like 3 or 4.
Okay,
It's
so
not
I'm
screaming.
gonna go up. Okay, like meaning that. Okay. So take an inhale. And then exhale, come towards me. I want you to stretch towards me. Keep going.
No.
I know. It's like I'm not going through the childhood shit.
Hey.
You feel the hip though, right? Okay, so that's what gets rid of the sciatica stuff. As long as it's not stabbing and sharp. It's gonna
No.
feel like so intense. It's like I want to see over this wall and you can't see over the other side. Like you know what's over there, but you don't know, and you're
That is
pissed off.
your shit.
Yes, it is a little bit. Still, doghouse needs to be cleaned out. Maybe some old lady undies. Get some.
Did you just say something about moldy undies?
Mold your old ladies.
Oh.
It's not bad. This isn't bad. The sock is worse.
I treated my feet. I cast them around my feet last night.
Well, I probably need to cast around my whole
Because I
body.
was thinking it might help move shift.
But she's like, you're on your fucking feet and your breath, motherfucker. Shut up. Okay, go to the other side if you can.
Yeah.
Alright. Alright, so this one I'm doing, there's the fire log. And if somebody has sciatica and they feel like pinching, teach them, even if they look different, everybody's gonna look a little different. Even if she's higher up, lower, and then I check in, where are you feeling this? Intense. Right in here. When you lift this leg up, lift that leg up a little bit, but I'm gonna do it for you, so just relax. And when you lift that up, does that help lessen that pain on the other side?
Kinda. It moved it into the inner thigh.
Okay, instead of just directly into the head, right?
Yeah.
So in her situation, it's like yoga training. If there's an adjustment you can make, it'd be to lift this up a little bit, or sit up on a block. And I'm not saying you guys have to do all this. It's not yoga training, but
I burned.
it did smell. It was almost like eggplant pepperoni.
I
It was a
get
little like eggplant and pepperoni. We might actually do well on this YouTube.
We've covered about it all.
Black and salmon. And a little pinch of onion powder.
Yeah, dude. Yeah.
Okay. So listen. Question. Do you feel it's easier right now than the other side?
Good question. I honestly couldn't remember.
Lift up and come forward. Relax your shoulders. Yeah, good job. You can pull the foot towards the knee. Yep. So I'm watching her body because as she's coming forward, she's leaning to that side more because it's so fucking tight over here. Yeah. And that's where are you feeling it in that side when you're doing that?
It's really.
Yep, and stay there too. Okay. So what I'd like you to do for that, because your psoas is stuck on that side, I'm gonna suggest, as you can do it on the table on the floor, go ahead, jump off the table for a second. So on your left leg that's bothering you, I would do this number and do one of these. And that's like a fire log lunge. It will stretch the inners on both sides.
On the table.
Yeah, or the floor, whichever one you're here. So I'm just doing trapeze stuff. Yep. Yep. And you want to go as far up as you can with like the distance between your front foot and your back knee. Yep. Yep. Good. And you can. Yep. Do you feel intense stretch in both the hips?
It's in here.
Yep. That's good. It's the whole thing though, right? Not just isolate to one static spot. So whenever, this is a great way to assess the body. When someone's like, I have pain here or here, you can then turn it and be like, okay, how do I do that? If it's sciatica, I'll do the fire log. If it's feeling here, I'm gonna stretch it back. Does that make sense? There's different things you can play around with to assess the situation. Everybody's body's gonna be different, but I'm telling you guys, Thai yoga is the way to go, or Thai massage, whatever you wanna call it, Thai table, yin yoga, it's all the same. You doing okay?
Yeah.
You just want to get the fuck out of that. Yeah. And when we're holding stuff for a long time, you want to run away from it, and that's normal. At least take little baby steps like you're doing. Know what I mean? All right. Did we do? Oh, okay. Then I'm gonna do the psoas one for you. Go ahead and lay on your side like you're laying in bed on your right or left side, and I'm gonna give you. Do you want a little bit of a blanket for your head? Yeah, that's what I'm gonna do for just so that you're comfortable. Sorry, not my right. Let me just do this here. There we go. This might actually help your situation. Is that too high, a little lower? Let me find it out a little bit. Let me find it out a little bit.
Good girl.
Just I'm gonna get a ball like this.
What do you want me
Yeah,
to
we
do?
won't- do we
What should
roll
I
it
look like?
Well, I want your
Professional.
head to be good for you.
It's good.
Do you want higher or lower, ma'am?
I think it's good.
You all right?
You tell me.
Okay. You want support in the cervical neck region, like right in there.
Oh, ready?
Is that good?
Yeah.
Okay. This is not pubic, it's been washed, that one.
That one.
Well, you know what I mean. Sometimes the woolly blankets, you know the woolly blankets, they like
they won't let
they
you
get
go to
everything. The crumbs, the hairs, it's like, you know what I mean?
Yeah,
So it's a
yeah.
clean
They
one.
won't catch pubic, that's
Yes.
too abstract. It'll get past the sensors, you can.
All right, here we go. So I'm going to put my palm
Yeah.
in her glute area up here.
You're gonna find it. There you are.
Here you are. Okay. I'm sorry, you know me. One at a time. I care about you. Okay, take a nice breath in. I'll be gentle but with teeth. Ah, okay. Breathe in. Good job. I'm here to help, okay?
Oh, dude, you're asking a lot.
Okay, are you doing all right?
Yeah.
Straighten that leg out, the other one.
Which one? Okay.
The one she's holding back.
I can't.
You holding it?
There are so
comedy and a little bit of Thai work, have at it.
This is what happens.
Here we go. Wait, doing good.
How can you learn without having fun?
I'm only gonna live here, I think. I mean, this one time. Oh, fuck, dude.
You okay? Where are you feeling
Yeah.
it? Point.
I mean, where your hand
Is
is.
Jesus here?
Yeah.
Point to where it hurts.
Here.
Is that better?
You were right. You put your hand right on it.
Do you want me to
knew
keep
where
it here
was.
or there?
What's the best way?
So this should make you feel like you're feeling a stretch here.
It's not there at all.
There's no stretch here?
No.
Wow.
You're
Good.
that pain. That's fucking intense.
Hold on. Now tell me if you feel it now. Hold on. Do you feel it now?
Yeah. Now I do. Oh, fuck.
Okay, I'm sorry. I think I just ripped my pants.
This is why you
It's
have
rolling.
it on fire on YouTube.
Yeah.
If this video is shaking all over the place, we know why.
Crystal, yeah.
Crystal is laughing.
Let's see the comparison. Where are we doing
Now we're on the leg. It's in the
Huh?
leg. It's all in the
Good,
it's all
good,
in the
good,
upper
good,
and
good.
the top.
Good. Feels really effing intense. Like you're trapped in a bear trap.
Yeah.
It's a happy one though.
It looks like you're breaking her.
It's
1 to 10.
it's like
10, you need to get an ambulance.
it's like a 5 or a 6.
Oh, we gotta go further then.
Yeah, it's getting there.
Breathe in. And exhale. Good. Okay.
That was nice.
That okay?
That felt good.
All right, I'm gonna show them the chest opener, but we're not gonna do that until this weekend for everybody because it's a lot and it can be intense. So I'd like to lay in their belly down. I'm gonna do the cobra on you. You know, which would be best. Yeah, well. Okay, so legs a little bit open. Okay. So this hits points in your bum. And go ahead and extend your arms back towards me. And you're gonna grab onto my arms, like whichever way. Yep,
I'm
go
sweaty
ahead.
palms.
Yep, sweaty palms.
Sweaty palms.
Yeah, just relax down for a second, take a nice breath in. And then exhale, lift. And tell me when.
So I'm only feeling it in my arms.
Okay, not in the chest.
No.
Let's go up higher. Okay, ready? Take a nice breath in. And exhale. Now in the chest.
No. No, it's only in the arms.
Oh, God. Is that hurting you?
It's an intense stretch.
Can you show the arms a little better there? Yes,
A little bit.
Okay. So grab my arms that way then.
Yep.
Are you ready?
Yep.
Breathe in. Relax. And exhale.
Still in the arms. A little bit. It's not. It's just in the arms. Okay.
Oh, we're
It's
just
like an
looking.
intense. You know what though? What I haven't asked and wanted to talk about is that I've been experiencing lots of fatigue from doubling down on like massage and fucking surfing.
So you need, yeah, that right there.
Yeah.
You need to work your arms. Right there. So I want to teach each of one of you something right now, which is very important. So because of massage, your arms are going to get fatigued, like she said. My recommendation is do this on yourself. Just go inside here if you want. You want to be able to make sure that you're, it's fine, it's not wrong or anything. You want to make sure, sorry. So you can strip it with the form, but you want to be careful and easy because you want to just feel it first before you just drive into it. Nope. Good. Okay. And then let's flip it inward. And sometimes I like to palpate to feel where it is. Right there. Yep. Okay.
I ended up with a very sore elbow and forearm after doing some of these techniques this week.
Yeah, you did. Yeah. The Lomi stuff, you mean?
Yeah, I mean, I was all excited because I wasn't using my
Yeah,
hands,
yeah.
but then
Yes.
like that, and my elbow actually was really sore the next morning.
So the thing I want to suggest to each of you with this is it's stuck right there. Do you feel it? So you can do this to each other, but you can also do it on yourself. Like pretend I'm Home Alone, right? Home Alone, it's a great movie, right? You can do it to yourself.
Oh, yeah.
You know what I mean?
Yeah.
And I recommend it, to be quite honest with you, because you will burn out as a massage therapist if you don't get regular massage once or twice a month, and or try to do some self-care for yourself. This is your homework for this week for yourself, is do this.
This is really good.
And I want to show you guys something.
Oh my god.
Come and watch this. Watch your fingers. So the flexors and extensors control grabbing and doing, our motions with hands. So a lot of people, when they have carpal tunnel issues or wrist issues, it's because these are so hypertonic from over typing or lifting or whatever people are doing. So you know that there's good blood flow and good muscle mobility or whatever, range of motion and movement when the fingers do this when you're doing these muscles. So my fingers should naturally, I'm not doing it, it'll naturally do that from that response to the muscles. So watch the hands. Isn't that crazy? I should open back up. Fucking hurts. It was twitching. Did you see that? So people that you do this to, or you teach them, you can teach your clients. If, say, I'm doing this, and then it's like nothing's moving, that means there's layers of hypertonicity in there, and they need some serious support. Okay. That makes sense?
If the fingers aren't moving.
Yes, you want movement in the fingers, and if not, there's a blockage.
No
and you need
reflection.
Yes.
Or what do you call it?
Flexion.
flexion, extension. Yeah. If your fingers aren't doing the flexion extension thing, moving like this for the most part.
No
not that.
reflex, or what do you call it?
Yeah,
When you're neurologic,
Yes.
the problems.
The muscles are so tight and hypertonic that it's signaling those the neurons to communicate with the motion of the arms and the whole setup. But I would do both sides, nice and slow, all the way to the end. You don't all the way to the top. Yeah, like that. Cool. How are you feeling?
Good.
Okay.
How would you say you felt before and after?
I wasn't like, I only am noticing it when I'm like, oh man, I've been on my feet for like more than an hour, or the friggin' chick sitting in the chair for
Yeah.
like, because the job is in the chair.
Right,
They
right.
want you to